At the Office of the Fresno County Superintendent of Schools, we are proud to bring you Education Matters in partnership with Educational Employees Credit Union, Fresno State, and Chevron. Thank you for watching and supporting positive stories about education.
Many students say they learn best by doing and experiencing the real thing.
In tonight's Education Matters report, Juanita Stevenson with more on how students in a medical pathway program are getting to learn in a hospital setting.
And there are 3 sections of the small intestine. What are they?
Students enrolled in the patient care pathway at Clovis East High School have the benefit of great resources, including lifelike mannequins that can simulate real symptoms.
So they have to mount.
They get as much hands-on experience as they can in a classroom setting.
You gotta get 2 dots for 2 minutes.
But teacher Kelly Eichmann, who's also a registered nurse, knows there is no substitute for the real thing.
You can't simulate someone having a baby. You just can't. You can't simulate someone having their appendix removed. You can't simulate a student able to sit and hold someone's hand when they're sick or they're dying.
In an effort to give students that real experience, those enrolled in the medical careers and health classes participate in community classrooms 2 days a week.
Here, we want to place them in some kind of medical facility. And because I have a wonderful partnership with Community Medical System, we're able to place students in the hospital.
I got to work alongside with nurses and doctors, and I got to help patients hands-on along with the nurses, and it was amazing.
17-year-old Emily Zhang volunteered in the endoscopy department at Community Regional Medical Center.
I'm making beds for arriving patients, and then we are restocking the vitals and all the necessary essential things.
Once a year, the students present to a group made up of their community partners and school counselors. It's a showcase of what they've learned.
A registered nurse is like my scope of practice that I chose for my poster. They take vitals, administer medications, stock the rooms.
16-year-old Lily Hicks says her experience of volunteering in the emergency department reinforced her decision to become a nurse.
I am really lucky and grateful for this class because now I understand that I really do want to be a nurse and I won't just be a person spending all this money on classes and stuff that I won't need because I realize that I don't want to do it.
Eichmann says that is one of the pluses of community classrooms. Students can make career choices early on.
It is life-changing. It is life-changing for them. It is life-changing for me to hear what they've gotten to experience.
For Education Matters, I'm Juanita Stevenson, KC24, local news that matters.
And one final note here, Dr. Eichmann says she would love to have more hospital departments reach out to mentor students.